This conversation explores the challenges faced by healthcare professionals, particularly within the National Health Service, NHS, focusing on the importance of compassion, both for patients and for the healthcare workers themselves. The discussion highlights the self-sacrificing nature of those in the NHS and the need for better support systems to address their mental health. Please kindly like, share, and subscribe for more hot gists like this. The initial observation sets the stage for the conversation, noting that within the NHS, the individual's well-being often takes a backseat to the needs of others. Healthcare professionals prioritize patient care, frequently neglecting their own physical and emotional needs. This selflessness is attributed to a strong sense of duty and a reluctance to burden colleagues with additional work. The speaker emphasizes having witnessed this firsthand while working alongside doctors, nurses, and paramedics. The conversation then pivots to the challenge of identifying individuals in need of support. The speaker acknowledges the increasing concern surrounding mental health within the NHS, recognizing that unless issues are repeatedly raised, they often go unaddressed. This underscores the difficulty in identifying those struggling silently and the need for proactive measures to address mental health concerns. The introduction of Dr. Rich, a clinical psychologist leading the STA Psychological Support Center, shifts the focus to the concept of compassion. Dr. Rich emphasizes the importance of not only extending compassion to others, but also receiving compassion in return. They highlight the significance of recognizing one's own value and the need for self-compassion, particularly within a demanding profession like healthcare. Dr. Rich's work at the STA Center revolves around fostering this understanding of compassion, both giving and receiving. They emphasize the importance of acknowledging individual coping mechanisms and recognizing that everyone handles stress differently. This individualized approach is crucial for providing effective support and ensuring that the unique needs of each healthcare professional are met. The conversation then touches upon the importance of self-care, suggesting activities like spending time outdoors and enjoying fresh air as essential for well-being. This reinforces the message that prioritizing personal needs is not selfish, but rather a necessary component of maintaining both physical and mental health. The speaker underscores the importance of these practices not just for patients, but also for the healthcare professionals themselves. The final part of the conversation shifts to the context of the COVID-19 pandemic. The speaker, having treated one of the first COVID-19 patients in the hospital, reflects on the challenges faced during the early stages of the pandemic. They express the difficulty of recalling the events of the past 5 years, highlighting the profound impact of the pandemic on the healthcare system and the individuals working within it. The memory of performing swabs on patients in February 2020, with limited knowledge of the virus, serves as a stark reminder of the uncertainty and fear that characterized the initial response to the pandemic. In conclusion, the conversation provides a poignant reflection on the challenges faced by healthcare professionals, emphasizing the need for greater attention to their mental well-being. It highlights the importance of compassion, both for others and for oneself, and underscores the need for supportive environments that encourage self-care and address the unique challenges faced by those working within the NHS. The conversation also serves as a reminder of the profound impact of the COVID-19 pandemic on the healthcare system and the individuals who dedicate their lives to caring for others.